So as we are looking now to the fall, tomorrow is the 1st of September. We are entering a new phase of our BC COVID-19 pandemic. The increase in the number of new cases that we have seen over the past few weeks remains a concern for all of us, and we all have to do our part to ensure community spread remains low and that we are actively supporting public health teams to quickly manage these new cases so we can contain the spread and find that balance that we need. After many months of restrictions, we all needed to reconnect with our family, with friends, with our communities this summer. We traveled, we enjoyed our province, and many of us recharged. Now we must slow down on our social interactions, and we must prepare for the respiratory season ahead. We've talked many times about the fact that we will likely have a second wave. We've seen a surge in cases, but we've managed to keep our curve flat, and we need to continue to do that work as we move into our respiratory season. To be successful in this next phase, we need to step back to allow us to safely move forward in this pandemic. And I need everyone to pay attention. As the cooler weather arrives, we all have to be ready. We have seen the challenges that this virus, COVID-19, has, and now is our time to prepare. As we step into our offices, our workplaces, our schools, we need to take a step back from some of the social interactions that we have had this summer. Being ready means all of us getting back to the basics that we know takes to control this outbreak. So that means going back to our layers of protection and our personal COVID-19 safety plans for us and our families. It means washing our hands regularly, keeping our groups small, giving others the space to stay safe, particularly in uncontrolled environments, and sometimes that means wearing a mask as well. Particularly when we're around people that we don't know and avoiding those face-to-face contacts. It means always, always, always staying home if we're ill. If you have elderly relatives that you live with or you spend time with or you care for, you may want to spend less time with other contacts, with other friends. If you live in a small apartment, then large parties with even 10 or 15 people is not safe for you or for your guests. We need to rethink gatherings, particularly ones that we're going to have indoors. As the weather changes and we move towards more indoors, we need to keep our visitors to a minimum. And we need to think about the restrictions that we have in place, for example, at restaurants, where small numbers, 6, for example, or the restrictions that we have in place in our short-term rental properties with a maximum of 5 visitors. Those are the guidance that we need to use in our own personal settings right now to make sure that we can continue to do the important things we need in our communities, which means going to work, which many of us have been doing for some time, but more people will be doing in the coming weeks. Staying home when you are ill is one of the most important things all of us need to keep doing. It can be difficult to tell the difference between a cold and allergies and influenza and COVID-19. And as a result, the first step for everyone is to stay home if we're not 100% healthy. And that is a challenging thing. I know that. But the bar to stay home needs to be lower than we have ever had it before, for us and for everyone in our family. Our superheroes now are not the people who put aside our illness and go to work, but the people who protect our colleagues and our communities by staying away until we're healthy again. I ask employers, caregivers, and parents to think ahead and to prepare for the coming weeks and those days when an employee or your child is feeling unwell, and make a plan for how you will manage that. And employers, this is a time we need to continue to be flexible, to ensure that we're giving employees what they need to stay home, to work from home if need be, without recrimination or financial harm. No one knows for sure what the fall is going to bring. We may see a surge. We may see a surge in influenza. We all need to be prepared now for whatever challenge may emerge. To ensure we can continue to protect our most vulnerable, the people that we know are more likely to have severe illness with this disease, to protect our healthcare system, to make sure that we can continue to have those surgeries, that we can continue to have visits in our long-term care homes. These more challenging, colder months, we have to close those gaps that we have had here in the summer and flatten our curve again. COVID-19 requires new thinking, new routines, but following our proven layers of protection will keep us all safe. Our goals for BC are clear. We need to prevent cases through our renewed personal safety plans. We need to pay attention to how we are feeling every day so that we can detect new cases as quickly as possible. And we need to support our public health teams that have been and will continue to be there for all of us over the next few months or years, as long as it takes, to quickly contain the spread of this virus. We know that is working, and we know that's what we need to do to keep us safe. So let's start today to find our new balance. Let's start September knowing we are united in our singular focus to keep going, to keep our communities going, to keep our elders, our seniors, and our families and ourselves safe every single day.